I'm David Lombardo, and this is WCNY's The Capitol Press Room, and we're exploring how the 2026 legislative session in Albany, as well as the adopted state budget, impacted the work of organizations providing services in the fields of foster care, adoption, family preservation, and juvenile justice, which are represented by the Council of Family and Child Caring Agencies. To discuss the good, the bad, and I guess the in-between, we're joined by the Council's President and CEO, Kathleen Brady-Stepien. Thanks for joining us in the studio, Kathleen.
Thanks for having me.
So I want to start with, workforce funding, because heading into the budget process, your members, as well as the human services sector organizations more broadly that work with state and local governments, were looking for a cost of living adjustment from the state that would keep up with the operational cost of inflation, including personnel. You got a 2.7% increase, which does not keep up with inflation and comes after multiple years of increases, which, while probably better than what the experience was under the Cuomo administration, still didn't keep up with inflation. What's the significance of the half a loaf you are receiving?
Well, we're glad to see the support included in the budget. This is the bare minimum that we need year after year, right? We need to keep up with the consumer price index because that's the inflation that we're all contending with. And so while we're glad to see that included, it has to be way more, right? And we have to be having conversations with the state and the legislature just about how our government set rates are not keeping up with inflation. And there's everything from us needing to be a competitive employer and pay our staff more to dealing with operational costs like energy, food, insurance that go up year after year. And so we've got to do more beyond what was included, though we're grateful that that was included in the budget.
Well, what do you do to make up the difference? Because I think anyone who's had to pay a utility bill or tried to keep someone on staff has seen that their costs are rising by more than 2.7%. So do you just have to cut elsewhere, or are you fundraising? I mean, what makes up the gap?
Yes, we do try to fundraise, but the reality is we're 90% plus funded by government. And so we need government as a partner to raise those rates such that we can keep up with all of these costs. Another thing that was included in the budget that we're glad to see is some support for tuition for our workforce as well as loan forgiveness. And so if we're only able to provide, let's say, 2.7%, right, increase to keep up with cost of living, we have to do more to even it out to be a competitive employer. And that looks like loan forgiveness, scholarship, and any other support we can provide for workforce.
Anything else that stood out to you from the budget for good or bad, or maybe was something you were looking for that was missing?
Yeah, we're happy to see the support included for families. And so the child care support is key. That is a need shared by all families. And so kudos to the governor and to the mayor for including that. We also saw some rise in the child independent tax care credit come in. And so that helps to alleviate some of the financial stress for families. And yet we're looking for the state's support still on a key issue for foster care providers, which is insurance.
Yeah, can you expand on that? I mean, we've talked with Bill Getman of Northern Rivers about the skyrocketing insurance costs that these providers are facing and the lack of any sort of wiggle room or breathing room. I mean, what is the problem and what is the relief you're looking for from Albany?
Yes. The problem is that in recent years, insurers have looked at all child caring supports, all child caring agencies across the country, and have started to drop their risk. They're assessing that these programs are too risky to insure. And so they're either dropping out of the market entirely, which we've seen, and or to the extent that they're still providing insurance in the space, they jack up the prices and they lower the coverage. And so this is a national issue that our providers are up against. And in terms of the relief we're seeking here in Albany, we have a bill that we've been working on that passed the Senate this year, didn't pass the Assembly. We'll be back at it next year.
Sure.
But the bill looks to establish a state risk pool so that we ensure that there is an insurance option for foster care providers in the state of New York. If we can't get insurance, then we can't operate. The bill also looks at some short-term relief, which is modeled off of another state, what they provided in California, short-term bridge funding to help deal with the skyrocketing costs.
Well, what happens in the interim 6+ months, if not longer, before there is any sort of legislative action? What does the status quo mean for the members trying to provide foster care services?
The skyrocketing costs are a huge concern for us. our providers are reporting anywhere from 20 to 40% increases year over year. And we just talked about a 2.7 cost of living adjustment, and those numbers don't match up.
Sure.
Right? So the state needs to urgently act to at least help our providers with the short term, while at the same time providing for the long-term insurance. And so we're going to do our advocacy job in the coming 6 months. And we really need the state and certainly the governor's administration to act with urgency alongside us so that we're ready to tackle this challenge next year in New York.
I mean, it sounds like a crisis is what these organizations are facing. So I'm curious if there are any sort of emergency tools or levers at the disposal of either the state agencies that oversee this work or maybe the Division of Budget to either free up some money or to provide some other sort of regulatory relief.
The Division of Budget and the State Office of Children and Family Services are right now working on the state set administrative rate, which is called the maximum state aid rate, that funds foster care programs. Our rate year is going to begin on July 1st, and we don't know when we'll see that rates package. Usually it's sometime just after July 1st. They could act to put a solution in there. So essentially they could just lift the components that we've put in our bill to put that in the rates package to help with immediate short-term relief. And so we've urged them to take this seriously, to really act with urgency, because we do see it as an urgent issue here in New York.
And we're not talking about the human services sector field more broadly. I mean, we're talking about foster care specifically. So do you have a sense of a meaningful dollar amount that would help you guys address these rising insurance costs? I mean, are we talking in the millions, or is this something that has a B before it?
Yes, we have looked at this and we have done the math behind what our providers' year over year cost increases look like. And so this is $20 million that we have suggested would meaningfully address this in the short term, again, really to act as a bridge to a longer term option, because we've got to make sure that there actually is an insurance option for foster care agencies long term.
Well, I want to talk a little bit more about the foster care space, but first let me reintroduce you. For listeners just joining us, I'm David Lombardo, and this is WCNY's The Capitol Press Room, and we're speaking with Kathleen Brady-Stepien, the President and CEO for the Council of Family and Child Caring Agencies, whose members provide a range of services, including foster care, adoption, family preservation, and juvenile justice. So during the legislative session, state lawmakers unanimously approved a bill that is supposed to ensure that voluntary foster care agencies are providing clinical services to entire families connected to the child welfare system. What's the significance of that legislation compared to the status quo?
Right now, we have families that are connected to our young people in foster care that we're caring with come to us with needs that we're not able to address. So we have to refer families out into the community. And what this bill would do, and we hope the governor signs it into law, is allow us to work with the whole family. Right? And so there could be a family that has come to us that has experienced intimate partner violence. This bill, should it become law, would allow us to provide care and support both for the young person in foster care who's currently with us, as well as for the parent that has experienced intimate partner violence. And so we're really working holistically with a family to help support their goals, because we always want to be working towards reunification, right, whenever possible, of a young person and their parent. It's also really a matter of convenience.
One-stop shop.
Exactly. For foster families, they could have a young person in foster care that is sick and another person in the home, right? Another kid in the home that's also sick. And so let's make it easier for them. They could come to us and get care for both kids rather than having different appointments on different sides of town.
So I see the efficacy argument there, but from the perspective of your members, is there some reason they benefit from that? For example, does this open up new revenue streams by providing additional services?
Yeah, this would be if our members assess that they can open up this capacity, right? They'd have to hire additional staff and provide additional care and services. So, I guess you could say that, but really the primary reason is that we want to be able to provide care to the whole family, whether it's the foster family or the family of origin for the young person. And right now we do have families approaching us with these needs, and we have to say, sorry, you can go and see this other provider in the community, which really is not convenient for the family.
More broadly speaking, do we have or do a good job right now of trying to create one-stop shops? I mean, is there a problem where we're having to send people through multiple doors to access a variety of services?
Yes, and arguably there's the mental health settlement right now, that the state is contending with that shows you that we simply do not have enough capacity and services for that type of one-stop shop. And that's our ideal goal. What we always want to create, again, is to just really take the needs of the whole family and the whole person and to try to support them. We do our best to coordinate care and services, and yet it's really a lot, especially for a family that has gone through this trauma of being separated from their children. If they come to us in foster care, they're already going through a lot. And we could do a lot, I think, hopefully through the settlement to try to make it easier for them to coordinate care and services and make them more available.
Well, since we've been talking about foster care, I'm curious what your reaction was to a ruling by the state's top court earlier this year, which invalidated what critics have called a sort of shadow foster care program, this host homes initiative that took off under the Hochul administration. I would say they're homes that act kind of like foster care homes, but are not licensed as foster care homes. Did you have any sense of that ruling and I guess what happens moving forward?
Yeah, it points to the need for communities to try to take care of families. And so, as I understand it, a large part of the genesis of that program was to try to help families that don't have those kind of natural resources, let's say
Sure.
an aunt, an uncle, a cousin, right? And so we can do better to provide those community-based services. And there's also something known as respite that we do provide to families in the short term. And there isn't enough of that, right? And so we could do more collectively to create more respite for families across the board.
Well, these host homes were sort of an unlicensed, shadowy version of foster care, which makes me wonder, do we have a capacity issue when it comes to foster care that we need to try to figure out how to address?
We have seen the foster care census decline very significantly in the last few decades. And so we don't have a need for more foster care, right? In fact, we have a need for less. We have done an amazing job in New York State of investing in prevention services to keep families safely together. And so we've seen the foster care census go from more than 50,000 kids in care in the 1990s to today, it's just over 14,000. And that isn't enough progress, right? We'll keep at it because we never want to separate a young person from their family. We want to support them so that they can stay safely together. And yet we have made a lot of progress here in New York such that we don't need as much foster care.
We've been having this whole conversation through the lens of the state government, but I wonder whether the different organizations you represent, whether it's the foster care space, adoption, family preservation, juvenile justice, have interactions with the federal government, and if so, how has, say, the last year and a half of the Trump administration impacted their capacity?
We are enormously concerned about the changes that are coming for families to be accessing Medicaid, SNAP benefits, and a number of our agencies have been involved in an effort in New York City specifically to help families access and maintain their public benefits. And so we are actively engaged in that work to help really mitigate any coverage losses that may come out of H.R. 1. And so our concern is really to make sure that families continue to have the access to these public benefits that they need. And we're all engaged in the effort together with the state and with our local government partners to try to make sure that happens.
Well, we've been speaking with Kathleen Brady-Stepien. She's the president and CEO of the Council of Family and Child Caring Agencies. Kathleen, thank you so much for making the time. I really appreciate it.
Thanks so much.
Support for the Capitol Press Room comes from O'Donnell and Associates, a public affairs firm providing strategic guidance to businesses and nonprofits on navigating policy and regulatory issues. More information is available at o'donnellsolutions.com.